webinar. Thank you for joining us for our first presentation in this four-part series in honor of Maternal Mental Health Month celebrated during this month in May. We are proud to be hosting a speaker series in hopes of enhancing your knowledge of this important topic. We are proud to be featuring a dynamic lineup of speakers who will present on topics focusing on parents' emotional well-being from a cultural lens every Wednesday this month. My name is Irina Polanco Ventura, and I am Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey, the agency providing this program via our Perinatal Mood Disorders Initiative. For those who may be unfamiliar with the Partnership, we are a nonprofit agency licensed by the New Jersey Department of Health, and our mission is to meet the healthcare needs of women, infants, and children in Northern New Jersey while coordinating education, outreach, and advocacy efforts through regional planning and collaboration. Our webinar today is entitled Social Determinants of Grief, the Impact of Black Infant Loss. I'd like to thank the New Jersey Department of Health for providing funding for important programs such as this one. And to learn more about our Perinatal Mood Disorders Initiative and Fetal Infant Mortality Review Program, which provides support to families who have experienced a perinatal loss, please visit the Partnership's website at pmch.org and click on the Programs tab. So before we get started, I'd like to review some important information. An hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us with feedback on the program. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available afterwards on the Partnership's YouTube channel. Also, we will be muting all attendees' microphones during the presentation, but we would love to hear from you. So please write your questions in the question box and the speaker will respond to as many as possible at the conclusion of the talk. Now, I'd like to introduce today's speaker, Dr. Stacy Scott. Dr. Scott received her bachelor's degree in Human Service Administration from Spelman College in Atlanta, Georgia, a master's degree in Public Administration from Bowling Green State University in Bowling Green, Ohio, and her PhD in Urban Higher Education from Jackson State University. She has spent the past 30 years designing and implementing programs to address health disparities in under-resourced communities. And in 2016, she founded the Global Infant Safe Sleep Center, an organization with a mission to empower the world's communities to achieve equity in infant survival. She is also the executive director of Babies First Network and is a senior project director and equity lead at the National Institute for Children's Health Quality. Recognizing the importance of being inclusive and striving for health equity, Dr. Scott leads the NICHQ's anti-racism and social justice work and serves as a champion of positive, equitable change. Dr. Scott specializes in coalition building and authentic community engagement, working in concert with quality improvement techniques which enhance the opportunity to make positive change in the lives of many. Here is Dr. Stacy Scott, Executive Director of Babies First Network, I love that name, by the way, to speak about the social determinants of grief and the impact of Black infant loss in families. Welcome, Dr. Scott, and please take it away.
Well, thank you so much. Thank you for that great introduction. I just want to, first of all, thank the Partnership for Maternal and Child Health for providing a platform to really help bring awareness around this subject matter. This particular matter impacts many communities, and in many cases, this subject matter may not be deemed priority for many, but it's a matter of life and death for a few. Although this is a difficult time, and we faced around the challenges of COVID-19, and that it added stress that is brought upon us, especially for certain groups in this country, experiencing a whole extra layer of stress, frustration, even death, because of the inequalities and inequities that they face in their daily lives. We see that data has truly showed the disproportionate impact that both COVID and racism has had on communities that are already challenged with infant mortality. The purpose of this webinar is to pay homage to Black mothers and families, particularly those who have and will experience an infant death. here I just want to show the disclosure. And please read this for a moment, and then I will move on to continue the webinar. Okay, thank you. So just give you a little background about Baby First Network, and really how we got into this work. Because much of the work that I do with Baby First Network, we see these infant deaths in real time. We really value the importance of underserved populations and recognize the persistent consuming grief that is experienced by many populations that increase the level of depression, substance abuse, suicide, and other serious health issues such as heart problems and high blood pressure and cancer. We are looking to address factors that impede an individual's ability to seek out support services for such reasons as racism, economic disadvantage, social class, and religious diversity. The goal of this webinar is to build awareness and encourage the utilization of support services to families that are impacted disproportionately by the loss of an infant. And again, this is just some of the services that we provide at Baby First Network. We have a whole professional core component to us that really provides education and training to nurses and child care providers. We work with funeral directors and paramedics. And then, of course, our community outreach, as you see here on the screen. We hold community health forums. We provide community mini grants to help organizations talk about the risk of sudden unexpected infant death. We provide some community resource tools. And then, of course, the real reason why we are here today is our loss support. And we provide bereavement support and services through volunteers. We have a lot of parents who are now serving as peer counselors. We get state referrals and resources. And we have a library of group materials for families, and they're all free of charge. Sorry. Just want to tell you how we really got started in this. We started almost 40 years ago with 5 support groups across the state of Ohio, and these were parents who had lost children to SIDS. As a result, this group came together and really pulled together and lobbied the state of Ohio in 2002 to create the Sudden Infant Death Syndrome program. And this program is really to ensure the reporting of sudden unexpected infant deaths that occur under the age of 2 in the state of Ohio. We work closely with the Ohio Court Association, local health departments. We again provide bereavement support to parents. We work with public health nurses to ensure that a parent who has lost a child is contacted and at least have the opportunity to be offered bereavement services, whether they accept it or not. And here's just some webpage. Again, you can go on to our webpage and see the different tabs here. We do have a whole host of information. So I'm going to start out today talking about the social determinants of health. And I know everyone pretty much on this call has had some, information around social determinants of health, really looking at the impact that contributed so many of these disparities that we see exist within our country. And it can go anywhere from income level, we go to food insecurity, transportation, clean drinking water, all of these things that impact us and our ability to be able to serve families and people who are in great need in our country. When I think about social determinants of health and we talk about social determinants of grief, if you really look at that, the same social determinants of health can also impact somebody's ability to be able to grieve. So that's how we derived at this particular title. I want to focus though on our infant mortality rates and really talking about infant loss, and for the day, Black infant loss. And if you can see again, this particular chart here that really specifies the disparities that we see. If you look at the Black line here, and we talk about deaths between less than 7 days, 7 to 27 days, 28 days up to a year. Again, this really shows a disparity. And I always say, this is me, I know we are working very hard to eliminate disparity, to reduce infant mortality. But until that is done, and you see this disproportionate number of babies are dying, my concern is who is helping these families. And unfortunately, when it comes to bereavement support and mental health, there's not a lot of resources out there that can provide the type of services that many of these families need in their hour of loss. So if we look at that and we look at these disparities and we begin to look at, the type of grief that these parents experience, and really trying to get a better understanding around this grief, the first thing I want to do, I'd be remiss not to even bring up COVID, and how it has impacted us even more within this last year, and really has made a major impact on communities who were already troubled by disparities and death. And so I just like to show this slide because I just want people to get a better understanding on where we are around since this whole pandemic started and what we see. And these rates are actually as of March 2nd, 2021, that really gives you an understanding on how death has impacted communities, all communities, but specifically communities of color. So when we really begin to look at and talk about COVID and talk about what we see, and I mean, we all know over the last year with all of the things that have happened from George Floyd, the Black Lives Matters, police, brutality, we have to say, and here's a quote, racism prevails. And just here at this quote, as they say, looking at the impact of essential workers and low-paid workers and how that even impacted this particular community even more, the number of deaths that you've seen and represented on that previous slide, that really found out how, again, how systems have failed us in the sense of being able to provide and treat our citizens within the United States. So I want to kind of talk about a little bit about understanding African American grief. And for me, this is a very tough subject. I began doing the research, and I tell you, I was a little shocked on how little information was out there. All my life, I've seen devastating impacts of premature death of families and friends. I sat through many funerals knowing that had a certain intervention had been in place, this person may have still been alive. I've heard the many rationalizations such as she's in a better place, he suffers no more, really as a means to deal with the inequities that may have caused being in a position of mourning. And so, again, this is a big concern. So if we really want to look at the historical perspective of, when we talk about Black grief overall and what the impact it has had on us over 402 years almost now, we see that African Americans have experienced a compounded loss of trauma, beginning with slavery. And it has played a more significant role on how we cope with a further loss and trauma. So as you see here on the screen, going from 1619, beginning with slavery, even in our emancipation, then going into the Jim Crow laws and the 1960 civil rights era. You see all of these things that were impacted. We see that there was racism both on the individual and systems level. There's impact of implicit and explicit bias, the inequities in healthcare, high infant mortality rates, high prematurity rates, high maternal morbidity. And so this is really the reality that we see that compounds with everything else that a particular group would have to deal with. So this again speaks to why we see that there's such a major impact of loss and infant loss in our communities. Sorry, jumping. So understanding African American grief requires taking a long look at the historical and contemporary experiences around the issue of death and recognizing the troubling facts. There's very little research on Black grief and its connection to racism and social injustices. We look at evidence-based and evidence-informed. And if you look at some of the articles and things that are out there, you can begin to see the mere fact that in doing this particular research, I noticed that even though African Americans, make up a vast majority of the population, we see that that we only found 31 published papers that focused exclusively on the African American experience of loss. And so today I want to share with you some of the outcomes of that. We know that, again, to really have a better understanding about grief, and that many people feel in doing this research that African American grief is no different from European American grief or Euro American grief. African American grief may be aversive for some whites to study because understanding African American grief could draw whites into understanding the pain and the premature death caused by white oppression and the indifference to that oppression. And so when we start talking about the experience of parents and really following some of the perinatal and pediatric deaths, I wanted to kind of focus on some of the literature reviews. I thought these were great stories to hear. And so when you talk about a child's death, it's one of the, pardon me, this train in the background, forgive me. Just a moment. I apologize, I live right next to a train track. I was hoping no train would come through. But anyway, I'll get back. A child's death is one of the life's most difficult experiences. Little is known about the unique factors that influence the grief experience of bereaved African American parents. Through an integrative review of 10 publications, the author describes the grief responses and outcomes and implications of African American parents who have experienced a death of a child. What we saw in doing that and looking at this, we saw that there are really 4 themes that emerge: emotional responses to loss, factors that added to the burden of loss, coping strategies, and health consequences of grief. When we look at health consequences of grief, and many might understand this, that one study found that if you look at the level of grief and the perception of general health, the researcher attributed that women defining health solely in the physical context and functions. So it kind of goes along with that whole kind of, I don't want to say myth, or the issue, especially around mental health when you are servicing Black communities. what we saw that in this study that mothers who perceived their health to be of a higher level, their depression. So if they felt that they were healthy overall, there was some indication that they still had a high level of depression, but they didn't look at their mental health and physical health as the same thing. There was interpreted because African Americans may view mental illness as a sign of weakness, not as part of an overall health, and consequently, many denied needing professional support from a mental health perspective. So we talk about being down so long that down don't bother me, and this is a quote that is used a lot and within the African American community, within music, that really talks about the fact that we've been in a place for so long, that we've been depressed for so long, that you just don't even react to it anymore. You just kind of just get through and get by. And so I really want to talk about strength. And one of these perceptions of being a strong woman or a strong Black man, and again, this culture mandates this strong. You know, we feel we have to be strong. We have to have the strength, especially for Black women. It is really something that has been racialized and gendered. Strong is a racial gender code word. It's a verbal and mental shorthand for three core features of being a strong Black woman. And if you see this author, and this is a great book I put up here if you get an opportunity, she talks about strong Black woman. She puts it all together as one word. And what we see these core features of that is caregiving, being independent, and having emotional strength. These are some key things that, you know, again, me being that of a Black woman who was basically raised by with the same framework, that this is what you're taught from an early age, the importance of being independent, the importance of taking care of others, and of course, of being emotionally strong. And so when we talk about who are these strong Black women, and in many cases, if you're providing support to these women, especially to these women who have lost children, you can see that these women come from diverse backgrounds, from all different ages. We have students, you can be from a historical Black college and university to an Ivy League school. They can be minimum wage workers who struggle to make ends meet. You can be a corporate employee, management level professionals. You can be married, single, with or without children. And despite the great social economic diversity, they are similar in many respects, regardless of their station in life. Each has a high sense of responsibility. And again, that serves as a load barrier. And so when we look at this framework and look at social determinants of grief, thinking about these women in mind, you see here are some key things that impact the ability to be able to grieve. You have a constant extension of self to others, driven by deeply ingrained desire to be seen as helpful and caring, incapable of saying no to requests without experiencing feelings of guilt and worthlessness, incapable of asking for help as she's saying no. Since childhood, she has been taught that good Black women are independent, a giver of help, including emotional, financial, and instrumental support, dealing with stressful life events. They are impacted by racism, they receive unfair treatment, and they experience other serious illnesses and untimely deaths. And so when we talk about being strong, we can see that being strong can also be dangerous. And whereas being a Black woman who is strong, it may be commendable, of being a strong Black woman may be dangerous. There's a myth there. There's a myth to the strength of Black women that often mask the very real vulnerabilities of their life. They are largely ignored health crisis confronting Black women in America. And during and since slavery, then the strength, I quote, of Black women has been a backhanded compliment a convenient rationalization for the oppressive circumstances under which Black women live and labor. So if you think about that as a Black mother, or you experiencing that loss, and now we take into effect infant loss, and how does that personify all of that? And so going back to the studies, was really here is I want to share with you just some observations and some lived experiences of African American parents. And I'm doing the direct quotes, so I want to let you know that I am just basically, again, from this particular study, they took their words and I want to share them with you. And in this study, there were 4 things that emerged: recognizing problems and responding to their losses, dealing with stressful life events, creating and cherishing memories of their infants, and living with the loss. And so here are some direct quotes. Again, misreading symptoms of pregnancy and complications. We had one father who said, "Not even with the water being broken, I guess for a week prior, we thought the baby was just sitting on her bladder and that she had no control of that. But that's the kind of stuff that comes with being first-time parents and really not knowing what happens." When you go into the next phase here, and then the next, again, what we see as some of the core issues, maintaining hope during medical treatment. One mother said, they said that there was no guarantee that she would live, not unless there was a miracle. I was believing in a miracle because I do believe in God and I had faith. But then there was really nothing else more they could do for her because she wasn't getting better. The next day, when I went to see her, she was real blowed up. I couldn't see that was her. So I told them, I guess it's time to take her off the machines because they said that her organs were so damaged and there was nothing else they could do for her. Another core is feeling intense emotions after the death. When she found out I lost a baby, she just held me like I was a baby. She rubbed my back and everything. She was real helpful. I don't know if I could have made it. I would never forget her name. I know their job is to be a nurse, but she didn't have to be that nice. She was really nice. She stayed there until my mother came. She sat in the room until my mother came, and I felt much better. Another component was dealing with a stressful life events. And so we had families and mothers indicate that they were feeling abandoned and unsupported. They had feelings that caused stress. Some mothers actually argued with the family members so intensely, they actually had to find another place to stay. We had several mothers who explained that they were deserted by the father of the baby when they became pregnant. There were some mothers who felt abandoned by their own parents, separated from them because of substance abuse or incarceration, and were not there during their pregnancy. And one of these mothers had an extra responsibility of raising her 3 younger siblings because of her mother's substance abuse. Suffering economic hardships, his mother said, I was still stressed out. I wasn't getting any rest. I was 8 long laboring hours. When I would go to the clinic, they were like, you are doing too much. You have to stop. You aren't giving the baby enough rest. I didn't really want to say to them that I was really going through. I had to have this job. It was the only way to support the kids and keep eating. The money I was getting from public aid was barely enough just to pay the rent. So it would be 2 or 3 days I went without eating, just drinking water and eating crackers One of them days I felt the baby move. I said, "Oh, you still surviving in there." Then we had families and talking about the experience of other serious illnesses and untimely deaths. Many of the mothers had close relatives who were seriously ill and were hospitalized during their pregnancy. There were parents experienced death of those close family members or friends. It also included an untimely deaths of infants, nieces and nephews, siblings, parents, grandparents, and young male cousins or friends. One father who was a substitute high school teacher had experienced death of 3 students in 1 year. Even if the death had not been recent, the current loss triggered painful memories of the other deaths. The other piece was receiving unfair treatment. We had parents that perceived unfair medical treatment. One mother reported an unfair treatment by the funeral director who buried her son sooner than she was told without her presence. According to the mother, the funeral director said that he did not know she wanted to be present for the burial. She said, "I was mad with them because they buried my son without me being there. How did he not know I wanted to go? My heart just dropped, like I didn't get a chance to say goodbye to him." One mother whose baby died after being in a neonatal intensive care unit said, "I feel that they didn't do the best they could. I think it's because of my financial. I was on public aid and so much that certain doctors would only do so much for people on medical card. But if I had had better insurance, they would have put their heart and soul into it. I just feel that they didn't." And then the father said, "I know she, his wife, was not in a private room and was not a VIP patient. But to me, she was a VIP patient." The father also perceived unfair treatment with regards to paternity establishment. He shared that his name did not appear on his son's birth certificate, even though he provided the requested documentation that he was married to the mother of his son. And we had creating and cherished memories of their infants. Parents created memories of their infants by, being physically close, observing family resemblance, collecting keepsakes of their infants, making decisions on infant burial, and including a memorial or prayer service. A mother said, "And I held him until about 4 hours. I said I loved him. I don't want him to go, but God knows best. Maybe I'm struggling so much that it would be just another burden. He knows best. Well, I just holding him and crying. I said, somewhere you get a chance to see your grandma. I tell him, when you get there, when you get old enough, you think about me." And then again, some more things that emerged living with the loss, which included encountering difficult situations, relying on spirituality, seeking diversions and support, making sense of the loss, and contemplating future pregnancies. And so, again, those were just some direct quotes and examples of what families go through when we talk about this type of loss. And I don't know if many of you do direct contact or support families in this piece, but looking at grief, again, that is a mental health issue. And many people don't look at that, at grief and bereavement in that manner. But, really being able to recognize the difference in grief, and being able to see that there might be a difference between Black grief and that it does differ for white grief, and that we can't assume that everyone shares a common culture when it comes to loss. But when we do that, we end up, again, whitewashing grief, and we overlook the grief of Black communities. The omission of Black grief is an act of oppression itself. It further perpetuates a society that privileges white experience. When white grief is assumed the norm, we see bereavement support is also based on the white experience. As a result, the unique implications of Black grief are never addressed, and Black individuals are never given an equal opportunity to grieve and to heal. So I want to kind of go into, again, what might be done to be able to help support Black communities, African American communities around grieving, and really acknowledging how Black grief is linked to racism and a form of oppression. We can take a collective step toward undoing this act of oppression and ensuring that we provide support services and exist that center around the Black experience. So here again is another resource. I just think it's important. And yes, these books, I mean, they're running in 2005, but unfortunately, there's not a lot of new books that are out. There's one that just came out called Grieving While Black, an anti-racist take on oppression and sorrow, that just came out by Brashia Wade about 3 weeks ago, that I am now looking at. But again, up until this point, there was not really a lot of books. So this is a very good guide that if you are interested. But it talks about African American grief is not like white grief. We are going to talk about cultural grief and the pileup of losses. We got grief therapy and support for African Americans, the African American diversity, and revising on how we think about grief. So again, talking about grief is, again, African American or Black grief is not that like white grief. We're asking that you be supportive and helpful to the bereaved African American woman and their families. Be attuned to and knowledgeable about racism in the United States, and become broadly familiar with the knowledge about African American culture. The other cultural grief and the pileup of losses, as I kind of talked about earlier, you really need to explore the concept of grief, which goes beyond a death, recognizing and addressing that both past and present losses may contribute to the grieving process. Understanding that African Americans may be impacted by loss related to centuries of racism, discrimination, and oppression. When we look at grief therapy and the support of African Americans, counselors and support group facilitators need to be well grounded in dealing with racism and discrimination in African American families. And I just want to stop here and give you a great example. There was a series of support groups that were held a few years back. And when a baby died in Ohio, we would make referrals to a support group. So there was a support group that was white and that we invited an African American family to attend. The family had lost their baby to SIDS. The grandmother, the mother, the dad, cousins, and about 6 people showed up at the group. When they were talking about their experience, the family really focused on how the police treated them when they called 911 and they came out and discovered their infant had died. They said that they really made them feel criminal. They were guilty until proven innocent. And they just kind of went on and was dealing with that particular anger. The support group that the facilitators, which were peer facilitators, basically said to the family at the end of the session that they felt that they were not equipped to deal with their issues. And they thought it'd probably be best for them to seek out some different support because they didn't feel like they were appropriate to participate in this particular support group. So again, here is a true example of being grounded in dealing with racism and discrimination, because now here this family was again alienated and sent on their way because, again, the issues that they were experiencing, the other people in the group had no idea and understanding. So not being able to deal with sensitive issues can be unhelpful or even hurtful to a grieving African Americans. It is important to be able to move beyond that rudimentary level of dealing with issues such as race, class, racism, discrimination, and other related matters. It could mean having to confront one's own complicity in the racial system and the way one benefits from that system. Also, you need to understand that there's diversity within the population. Acknowledging and support African Americans who are grieving would always require attention to the uniqueness of the individual, situation, and community. You can't not lump everybody into one particular category, especially if you're looking at communities of color. The African Americans differ in social class, religion, spirituality, cultural identification, along with a number of other ways. Then we have to really look at how do we revise how we think about grief. It's important that our country and the communities be understood that they're not homogeneous societies, but there's a mixture of different cultures, and they bring many different ways of understanding and dealing with death and dying and grief. So we must not assume that everyone shares a common culture when it comes to loss. And always remember that one person's grief does not invalidate another person's grief. All loss is irrelevant and impactful. We must keep hope alive. We must be able to support our families, our mothers, no matter what their race is or religion, but we have to have cultural humility in doing that, in dealing with grief, just like in any other public health arena and things that we do to serve our families. And so we have questions for you all. Considering infant mortality rates in the United States being what they are, why is it not a common place to provide bereavement support services to families who have lost infants? I'd love to see if anybody can weigh in on that.
There's one that says financial. The other one is, could you repeat the, oh, well, somebody else is asking to repeat the question as well.
Okay. Considering infant mortality rates in the United States being what they are, why is it not commonplace to provide bereavement support services to families who have lost an infant? And I agree with the financial piece. Unfortunately, even for the work that we do in Ohio, it is very difficult to find money to support bereavement support. And if you even trying to get into a mental health facility, again, looking at insurance and the very limited services that are provided, especially when it comes to bereavement. Anybody else?
I'm checking here. I think that there's some comments, but they're coming in. Give me a second.
No problem.
While we check the comments, Dr. Scott, I think from I'll weigh in from our perspective as far as our programs go. What we have seen is oftentimes healthcare providers do have a level of discomfort when it comes to working with families who have experienced perinatal loss and are grieving the loss of their, whether it's a pregnancy loss, infant loss, or the loss of a child. So we have found that continuous education is key, and really talking about the biases that exist, the uncomfortableness that exists, and even sometimes folks are unable to put themselves in the family's shoes and think that the right thing to do because of their own uncomfortableness is to kind of stay away when, families are just looking for someone to really be there with them, whether that's in silence or just holding their hand. So that's what we've seen from our perspective.
Okay, great. All right, in the organization that you're working in the partnerships, are there any type of bereavement services just in general?
Absolutely. We actually work with 24 birthing hospitals, and I would say that most, if not all, are very good with implementing, having protocols, having bereavement protocols in place. And that has been through advocacy, a lot of education, but we have seen throughout the years the change, the reduction of stigma when it comes to loss. And again, just the importance of the continuous discussion of this conversation and education. I'm actually seeing some comments come through, and I have an attendee that mentioned that could one of the problems be culture within the institution?
Yes, for sure. And that leads to actually our second question that we're talking about. What are some of the barriers that prevent African American families from utilizing the limited amount of bereavement services that might already be out there? And I do think culture is a major piece. Again, going back to what you said, Arena, about people not feeling comfortable and not really understanding all the multifaceted issues around grief. Because if you're already grieving for something else, and I mean, grief can go all the way, you can become homeless, you can lose your apartment, you can have all of these things, and it's a compounded grief that people deal with. And so to pull some of those layers of grief away, it takes a lot to be able to do that. And then also being able to offer some kind of solution. Yeah, so I definitely think culture is a major piece. Is there any other barriers that you see that might, families might not heed services, even if the services are available?
I think, Dr. Scott, to your point, in regards to what you said during your presentation, is the lack of services, support systems that exist for people of color, specifically Black and African American families, where, yes, there are support groups around statewide, nationwide. However, are they taking into consideration the cultural aspects of a certain family? And even, when you mentioned the story of the funeral director that buried this mother's child without her being present, how did that happen? Is that his normal way of his or her normal way of dealing with that situation, or was it because this was a Black family? And is there some implicit bias and non-intentional maybe omission of some asking the family, well, we can do it this way or that way, what are your preferences, and talking about the options available.
Right. I think there was a lot of assumptions being made to further go on her story. They didn't even give her the baby a grave marker, and she goes on to talk about how she just wandered through the cemetery trying to find out where her baby was buried, and nobody could even really tell her. So the story was just so tragic on so many levels. I think a big piece that we I didn't talk about, again, based on time, is just the overall endurance of Black families, Black people, people of color, that you've learned to endure without the outside support. And that you need to, in some cases, move to action. You are not afforded the luxury of being able to take the time to grieve, to deal with the loss. And as a result of that, you move on. And even though might be cries for help, people don't really see them and understand them. And that can be a major hindrance in getting the type of support or giving the type of support these families need. The other one is probably just a trick question. How can one find financial support for bereavement services? And trust me, I don't have an answer for that. We've looked at ways to be able to incorporate grief and bereavement, of looking at when there's opportunities through mental health funding mechanisms on how we can merge mental health and grief and write it in such a way that we can be able to provide those type of services. That doesn't always work. So again, beyond the sheer fundraising or getting people who recognize the sponsors, one thing that we saw that was a big turn for us as a nonprofit organization, when SIDS was very, the rates were much higher and impacted more middle class white families. Again, they fundraised, they had walks, they had golf outings to support the work of the organization. As those rates decreased and we began to see the disparities increase more of lower income communities who didn't have the ability to fundraise and support us like in the past, we really saw a shift in funding, which is unfortunate, but understanding it from an economic perspective. And so that is some of the challenges that we are experiencing because we don't have that network of parents like we used to who would help us champion the cause. Because again, looking at SIDS specifically, I mean, it's gone down more than 60% over, since the beginning of the Back to Sleep and now Safe to Sleep campaign, which is a great thing, don't get me wrong, but there's still many families out there who are still suffering, who we are still in need of providing some support to them.
Absolutely, absolutely. I also wanted to share a comment that came through. One of our participants writes here, I believe that many have interpreted the loss of a child as being intensely personal instead of communal. This interpretation needs to change because people don't feel like they have the permission to grieve. I think that's very powerful and,
Yes.
and telling. Family doesn't have to grieve on their own.
Exactly. That's very profound. And then when you hear people and even trying to have that conversation with someone, it's so uncomfortable. It really is, because no one imagines that they are going to bury their children, even adult children. Nobody, you want to believe that you're going to outlive your children, and the fact that you have a baby, especially in that perinatal realm, that you carried this baby maybe 9 months, but then again, it could be a miscarriage and an early miscarriage. It doesn't make any difference. What we are looking at is loss, and just if your baby survived and died, or if the baby never did, be born, it's still a significant loss and impact. And we need to provide support to be miscarriage, stillbirth, even looking at the loss of death within that first year and beyond.
Yes, absolutely. And just one of our final comments coming in, when talking about financial support and even participating in programs, one of the participants writes, also getting the buy-in from those who are experiencing the infant loss can be an issue. Resistance to participate in programs or services during that initial state of grief is difficult, and we see that with our programs where they're in this early stages of this grieving process, and it is so difficult for them to see the benefit of the programs, and rightfully so, because it is you're in a fog at that moment and almost in a state of shock. So I know that is definitely a barrier when it comes to families participating in certain programs that can provide support.
Yes, for sure. Well, Thank you. Here's the reference if you want to look at some of those as well. And again, I appreciate you all and this opportunity to be able to just share. I know it was some short insight here about what are some of the struggles that we see. So thank you so much. Thank you for having me, and I hope I was able to share some insight.
So thank you to the audience for submitting such great comments, and many thanks to you, Dr. Scott, for spending some time today.
Okay.
And
So
also,
sorry.
yeah, it's all right. And to Karen Amadeo, who is handling the technical back end of the program, Sarah Mueller-Robbins, our Director of Education, who helps us make these programs possible, and the New Jersey Department of Health for their support, and to all of you who have joined us today. Just a quick reminder that in about an hour, you will receive an email with a link to a post-program evaluation. Your feedback is very important, so please take the time to complete, and certificates of completion will be sent via the email you provided on the evaluation. So please make sure and check that it is correct, and you should receive your certificate within a week or so. Lastly, a calendar of the partnership's upcoming virtual programs, including next Wednesday's talk on the mental health of Asian American women, can be found at pmch.org under the Professionals Education tab. We also offer on-demand recordings of many of our past programs, which are listed there as well. Thank you, and we hope that you can join us at our next educational event. Please take care.